On the Healthy Human Revolution podcast, Dr. Lori Marbas interviews nutrition and lifestyle medicine experts and extraordinary guests whose informative and inspiring stories will empower you with the knowledge to transform your life and health.
Welcome to the podcast. I'm Dr. Lori Marbas, and I'm so excited to welcome one of my colleagues, Dr. Elisabeth Fontaine. How are you?
Doing excellent. So nice to be here, and thanks for having me.
You're welcome. And the fun part about you is you're one of our specialists, and well, our only specialist at this point.
There you go. You got to be the only specialist.
the one and only. And that is OB-GYN. And what a cool thing to mix together that type of specialty with lifestyle medicine. But can you tell us a little bit of history about, one, why you wanted to become a doctor, and how did you discover lifestyle medicine? How did that evolve?
Oh, that's a fun story. So first of all, people will recognize my accent. So I'm originally from Quebec. So prior to my medical school, I studied what you call here kinesiology. And then I did a master's degree in exercise physiology and obesity research. I mean, it was very cool. Like when I did my research, it was in genetics. So I was training 20 sets of identical and non-identical twins.
Oh, wow.
We had to find them first, and I had to train them for 18 weeks, 20 weeks. So I was totally responsible. So anyway, this was a good publication, but this is the beginning of my story. So I've always been very interesting. At that time, we were doing exercise, comparing genetic, but also overfeeding twins. Can you believe that? And those research started in Vermont, where I am now. But anyway, it interests me to, research was something, but I could tell that I needed to have the contact with people. So this is what brought me to medicine. And then my idea with medicine was to do sports medicine. I never, ever imagined I was going to do specialty in OBGYN. But in sports medicine, when I was doing my round, I realized that all these athletes, including you, because I know you train, would come and would not even listen to the recommendation. You're not supposed to run, get a tendonitis. Nobody listened. I say, that is not what I want to do. So anyway, evolving the story, I choose the specialty of OBGYN. And I only practiced a little bit in Quebec. I was interested at the time. I was supposed to do a fellowship in endocrinology, coming back into an academic center in Quebec. But I said, yeah, I'm just going to try and do something else. So I came to the United States thinking I was going to do a couple of years, and I did 27 years in a small community in Vermont, which was amazing because I really had a good place to raise my two girls, did a lot of activities. So I'm very active, ran marathon in those days, and I'm still active, do a lot of biking. But, with my background in exercise physiology and obesity, I've always been interested and look at my patient and tried to help them. So my patients were growing older with me and were starting to gain weight and were starting to have chronic disease. So as a good physician, I send them back to their primary care physician. They would come back on medication. I said, I got an idea that something else could be done. So I started exploring and trying to help them. And this is a little bit how I discovered the American College of Lifestyle Medicine. This was a while ago, probably 10, 12 years ago. So when I started with them, we were probably about 200 at the conference. And the last time that we had a live one, we were about 5,000. So it's been growing. It shows how this field has been substantially growing. And when I went the first time, I was not bad in exercise and nutrition. Well, I think I wasn't bad. But then I met those guys like Assistine and Ornish. And I'm like, you're kidding me. I'm a physician. I have absolutely no clue. And I'm somebody who likes to research. I had no clue of the importance of a plant food-based diet, how much it would impact the health of my patient. So I came home and I knew that the science was there, but I decided to do an experiment locally. So I took 15 people that had all sorts of different problem, disease, chronic disease. And during Thanksgiving time, I encouraged them to do with me a 21-day plant foods-based diet. So this was with the PCRM at the time. That was about what we had that was the easiest way to do it. But, we test them before, test them after, and show them the amazing results and how they felt. It was just, the difference was just so amazing. So we were kind of learning together, which is usually what works the best. You can come and tell people the literature says that, but once they try it, it's like Dr. Kreger, right? You got to put it to evidence. So people tried it and it changed their lives. And therefore, long story short, it was a very long story. So I made the lifestyle medicine and practice lifestyle medicine. I became the medical director of lifestyle medicine in my institution. And we also had what we call Rise Vermont, which was all over the state of Vermont to encourage changing lifestyle in order to help specifically childhood obesity. So I've started that. I was part of the founder of what we call now Rise Vermont, which is very interesting if you're interested to look at it. But community-based intervention is definitely huge. And then I kind of finished a little bit what I was doing here and was searching, with COVID, how do we do this? How do we succeed to reach people? And I had mentioned to my hospital how important before that the telehealth would be, but then suddenly everything was changing. And this is a little bit how I was lucky enough to kind of had the chance to meet with you and then discovered that, hey, wait a minute, I can do this in telehealth and continue helping patients. So obviously my biggest interest myself is certainly with women. I'm not restricted, but that's certainly where I have the biggest experience. And then maybe I should let you ask me a question because now I gave my life.
No, I think that's great. There's so much there. I am curious about the Rise Vermont. Can you tell me a little bit, what were those community interventions that you did?
So, the biggest thing is, so we started a community, a group in the community that was not only physician, but also people people from the school, retired individual. We sat down and we look at community health risks, the assessment. And what was at the top for us was definitely obesity and childhood obesity. So we decided that we were going to attack this, but we knew that by attacking this important, we probably would help a lot of other things. I think the biggest thing was, how are we going to do this? And my research allowed me to discover a group in Europe that had substantial result with childhood obesity. And the group at the time was called EPOD. So that's an acronym in French that in English means Together Let's Prevent Childhood Obesity. They had amazing results. If I could just show you the slide, when they were implementing in the school, they had about the same result. And then when they started the community, they had this substantial drop. The response was just amazing. Wow. So it was this infiltration of the community to try to make the change, the activity, having some champion that were from the community that was involved. So people that were known and were starting to get involved and explain things, and then some physical activities. We had a bike that was used to make shake that we would go into school to. I mean, all sorts of activity that involved not only the school, but into the city, and building some bike paths, some walkable area to the school, policy changes in the school. It's multiple little things that eventually, brought this to another level. So when we started, it was in our community, like us here, it's Franklin and Grand Isle. And then we presented with the team of Europe that came here. We presented at the state level.
Oh, cool.
And at the state level, they say, wait a minute, we need that for a primary prevention. And with our ACO that we call One Care Vermont, they decided that Rise Vermont was going to be at the state level. So we implemented program manager in all the different area, mainly through hospital. Of course, during COVID, it was a little bit harder, but it's still doing very, very well. So it's awesome. It's a growing. And one of the things that was important was to do measurement. So when I came with the idea that we needed to measure the kids, to weigh them, and we were doing that really in the sense that the kids were in the family, nobody was aware of their numbers to make sure that it was accepted. We did all the elementary school that was in Franklin, Grand Isle. So that was over for us. It's a small school, but every 2 years, we plan to measure them to see the progression. And we did a publication to demonstrate that what we measure demonstrate that the numbers were much higher. The risk and the number of obesity were higher than what we obtained with the typical YWRS, the typical evaluation that we do. People tend to tell the numbers being a little bit lower. So it's it's an amazing project. And actually we're helping in another community in Washington County. So
in Vermont?
No, this is not in Vermont. This one is in, let me think about it, Maryland.
Oh, wow. Okay.
So I'm helping with my business partner to build a community-based intervention and help them to describe a little bit more the evidence-based model that we had, and to help them to start from the ground. So it's a system that works very well not only from the top down, but the bottom up approach. So in order to involve it. So we're a little bit far, but it's lifestyle. It's, the impact that you and I have when we talk to one patient at a time, it takes a while to make a difference. If you get into the community and you can influence a lot of people, then you make a bigger difference faster. And people don't realize it. Things happen. So it's,
yeah, and you're changing the culture of the community for generations because you're setting those.
Hopefully that's the goal. Absolutely. Yeah, definitely
absolutely.
A passion.
Yeah, and if you don't start with your kids, I mean, why wouldn't you start with them? Because that's how it starts. I just think that's so very important. Oh, my goodness.
Absolutely. Yeah, it's amazing. And the kids has such an amazing message and influence on us. We just don't realize it. They just do things naturally. So you just need to give them the tool to understand. They're much brilliant than we are.
No, it was funny. In the conversation I had earlier today was about, we kind of just, is talking about how we have so many lessons to learn even from our own children if we're open to learning and open to the messages and looking and, perceiving them as opportunities to change ourselves for the better from these little creatures that are turn into adults. So
we have a tendency to think that we know it all, and we're older, so we know. And obviously, when they're younger, they tend to tell us that we know nothing. And then eventually, you probably notice when they get older, they finally realize that maybe we have a little bit of wisdom into the things.
There is a poem. It's regarding children as they start out as dogs or puppies and they turn into cats for a little bit as independent, and puppies are always looking and wanting your attention and just so happy and to see you and love you and snuggle, and then they turn into cats. They're independent, they put their
that's a good one.
And walk away, and they're like, I'll come back when I want to, type thing. And then they turn back into dogs as they enter an adulthood. I was like, that is brilliant. It does a really funny poem. I actually save it to send to moms who are struggling. I'm like, it gets better, I promise.
That's a good one. I wasn't aware, but
it's I'll send it to you.
I will take that.
Excellent. And so then as far as the lifestyle medicine with we can kind of talk also regarding women's health, which I feel is really not brought up. They talk a lot about more of the general chronic diseases, but we don't really speak to things that really affect women, like menopause symptoms, osteoporosis, painful periods, childbirth, pregnancy health. I think there's so many things there that we could be more effective at if we actually spoke about it more in our community of plant-based, lifestyle medicine. I think it's touched upon, but not to the extent that it should. What is kind of your favorite things to see with lifestyle interventions that really help women, at least more women prone diseases?
Well, I think that you're right. I think that the population are just starting to realize that the diet is so important, and that the plant-based could have such a huge impact on disease like diabetes and hypertension and cardiovascular disease. and cancer. They don't necessarily even think so much of the importance of cancer, and therefore you don't think that what would change in my diet would do to me as a woman. We don't think that way, but it's huge. It makes a big difference, just to know that even when you're younger and you get to the teenager, to make sure that you don't end up with too much fat, too much estrogen, with too much in the early menarche, that could have an impact. So early on you have this, and the premenstrual syndrome that could be potentially affected by eating a typical American diet that could be substantially improved with eating differently, like more of a plant-based diet. Cramp dysmenorrhea related to severe bleeding, that we call menorrhagia, that could be substantially reduced by sometimes losing some weight, losing some estrogen level in your body. And then you can keep going, because obviously you're talking about, when you start your period, and then premenstrual syndrome, and then fibroids, that are related to certain elements of high estrogen, and then the menopause. So all that, first of all, it's subject that is just starting. We're just starting to talk about women, their menopause. We know it's there, but people are afraid to discuss it openly and say, okay, what is my problem? We all get into menopause with different symptoms. No women is the same. And so that it is important to realize that by doing some changes, especially related to what you put in your body, could have substantial impact with a lot of all the things that I just said. It just takes a little bit of time. So for you, let's say, Laurie, I know you're very good with diabetes. Well, it doesn't take long that they see their numbers changing and they're convinced that, wow, I can do this. It takes a little bit more time for the women, and women are always questionable. Is this really going to work for me? So it takes a while. We need to talk. And that's why I said, what, group visit, when you can let them discuss, see what's, what they believe, they don't believe, they listen to each other. Tell you the truth, when I have a group visit, I do absolutely nothing. Once they start talking, I'm only there to monitor, make sure that they start talking, and they give you so much information. It's amazing. So a little bit of what you've been asking, I hope.
Yeah. What specific prescriptions of lifestyle medicine do you use for, let's say, women who are kind of suffering with menopause, or, the hot flashes, or the moodiness, the fatigue, the not sleeping well? What have you found to be beneficial for those women?
Well, it's comprehensive. It's not only nutrition. So you have to obviously take time to listen, which is often a miss part of us from a physician point of view, because we're in a system where you see somebody for 10 minutes and you cannot deal with somebody who has been going through menopause or having premenstrual syndrome. It takes a little bit of time, so you have to be able to listen. There is, with lifestyle medicine, as you probably know, some pillar that you have to be conscientious about. So the sleeping you just mentioned. So that's one element in itself that we have to take time and review what's causing the difficulty sleeping. Is it the hot flashes or something else? Then the stress level, obviously, then the nutrition, the exercise component, movement, and then the social that is related to that. So we have to you cannot just take one thing. Is it just hot flashes, like give you a pill, hormone replacement therapy, which could be indicated. You gotta be careful of trying to make all these changes. And then if it's an extreme case, sometimes the hormone are still indicated. So you just need to take time, listen, and make sure that you're going toward what is really needed. So the first thing is really the listening, which I really think that physicians are not very good at it.
So gathering data by observing and listening and discussing, just kind of the general, I almost feel sometimes like a private eye or a detective with patients, because they come in with these really interesting problems, but then you, like you said, you start listening and peeling back layers, and you're just like, wait a minute, there's a little more going on here than just this.
Exactly. The problem that they come up, you always have to think the problem that it's like coaching, because I do a lot of coaching. the problem that they come up with, it's probably not what they really need to. So you have to sit there and say, okay, that's what she's asking. Well, let me listen now and say, you don't tell them that, obviously, but you're like, okay, this is what the complaint that she has. Let me just start by thinking there's probably something else, but tell me. And you listen. And, I tell you, this is so huge. And I think this is such a big missing component. But then it allows you to eventually put the effort into where the needed is. Because sometimes it's the simple thing that you need to change, especially for the hot flashes. And it's not everybody, obviously, first of all, that will have hot flashes. So we always try to put everybody in the same bucket. You're a woman, you're all going to go through menopause at 51, you're all going to have hot flashes, just like my mother. And it's not like that. A lot of women do not go to that. And some women, it's extreme. So you really have to pay attention and being able to show them that in other populations, like in Japan, before they were placed with the same kind of diet that we have, they didn't have any hot flashes. So there is something that we need to be, careful with. So again, it would be prevention, and that's feasible, probably even better that before they reach the age of menopause.
Absolutely. It's just kind of like the osteoporosis. And it really was clarified. I was reading some research, as we talked about earlier, how we're really focusing in on osteoporosis and providing some resources for our patients. We're trying to build that a very good protocol guidelines, so to speak. And I was reading about someone's mentioned, osteoporosis is really a pediatric disease because we really have to be focused in on what are we doing to our kids to help them reach their, maximum bone mineral density by age 30, so to speak. And, I never really thought about that. But when you start looking at the causes of osteoporosis, and then we go to diagnose it at such a late stage, we need to be looking at this at a much earlier stage.
Absolutely.
What have you found are there any common denominators that you've seen with women as far as their osteoporosis risk? I mean, is it truly, you think, around menopause, or do you have any thoughts on they never quite reached it, maybe? I don't know.
So obviously it's difficult because we don't know, we don't have all these data. But in itself, we know that the numbers, obviously, women are definitely much more affected than men. And therefore, already that should gives you a little bit of a sign. Men has more muscle mass and more testosterone, obviously, but muscle mass is kind of a quote unquote preventive factor. So we always say exercise, but exercise, you got to be careful. Women, we tend to do exercise like aerobic exercise, sometimes excessive, because you're concerned about weight gain, you want to lose weight. Well, for the prevention of osteoporosis, it is more like weight-bearing exercise, like, doing a little bit of weight, obviously, but you can go for a walk with small weight and do it, or get a backpack and walk with a backpack, maybe not as long, but a little bit, you got to carry a little bit more weight. Now, the studies have shown that usually one of the things is that if you're a little bit heavier, you certainly have less risk to have osteoporosis. That's probably one of the benefits to be a little bit heavier. And I wouldn't encourage people to be obese or overweight to prevent osteoporosis, but that's probably, one of the factors that is a little bit of a prevention. And then obviously the problem is that if you were, and we discussed that earlier, the problem with the diet is that it's difficult to compare easily between a plant-based and the typical American diet. It's first of all, when we measure people, they're already a little bit older. So we don't know what had affect so much their level of bone. Is it because, they've never really paid attention when they were younger, and at 30, their level of bone was there compared to somebody else? That we don't have the information. There's also multiple other factors that plays. Yes, there's genetic, but there's also smoking, alcohol, taking some steroids will have impact. So, you got to take into account all these things and try to say it's an ensemble. It's not just one thing and say, at menopause, you need to do this and take medication. So those medications that are given on people that have been measured. So we can do a specific measurement that we call the DEXA. So it's like an X-ray of your bone and specifically checking the spine and the hip. That's probably the area where we can find more fracture, hip fracture or the vertebral fracture that women more specifically will have. And when it shows a bigger deviation, then we would suggest to those people to be on medication. But we got to be careful with medication. First of all, it's expensive. They often will have some side effect and not easy to take. And the studies are not so clear to how much they are significantly reducing the fracture. So the message basically is that prevention, prevention, prevention. We gotta be careful of eating a well-rounded diet, very colorful of plant-based, and paying attention to our movement that is a little bit more weight-bearing. That's the biggest message. And supplement, we got to be careful with that too. People think I'm going to take calcium, but most of these, first of all, I haven't proved that calcium will make a big difference. And the calcium supplement are often not even digested to the point that they transmit the best calcium. So it goes and doesn't really do anything to your bone. So simple message: prevention, prevention, prevention. Eat well, move.
What was that? Prevention?
Something like that.
Oh, I think that's great. I think you're exactly right. It is prevention, but we seem to be getting, it's interesting because people don't ever think about, oh, when you're 20 or 30, even 40, you're just like, that's there, that future, that risk, that concern. But then when it hits you, we're at this point with our bone mass. It's a big deal, this prevention. It's so very important. So women, listen, get out and move, and don't be afraid to lift some heavy weights. It's okay, unless of course you have osteoporosis and had a fracture, you got to be careful. But there are definitely specific guidelines for exercise. But exactly
and I think you're right. So this is one of those osteoporosis. We don't talk enough about it. It affects 12 million of us. That's 3% of the population in the United States, and of that 3%, 70% is women. So women, you're right. We got to do something about it and being more careful of talking about this. And those hip fracture, we don't think that it's related to our bone loss, and we have to be careful about that.
Absolutely. And I caution patients too, because I had I've had a few patients, I'd say, has anyone spoke to you about osteoporosis? And they'll say no. And I think primary care doctors have not done a very good job of addressing this. Honestly, I think we do a poor job, at least from my survey of the patients I'm seeing across the country. But sometimes they don't even want to get the test done to see if they have it. And I think that's an unfortunate thing, because that's just kind of the baseline marker. Then we can see where these interventions actually might be beneficial. But yeah, it's really interesting how they almost feel like putting their head in the sand and being ignorant is helpful, but it's not.
It's not all the time easy also to find a place where you can have the proper testing. And the recommendation is that age, majority is for women, is age 65. I would say that it's almost a little bit too late, because if you want to prevent, it's nice to see it before. So I think we're discussing in the group to have a good our group of lifestyle of probably reaching out to women a little bit younger, certainly reaching menopause, because once you lose the estrogen that are protective factor, it's even more important to be very careful about what you do and eat. So you can imagine that if we have our average menopause age being around 50, 51, and you wait until you're 65, right, there's a lot of things that could happen during this period. So, and you have to think that once you get a hip fracture, the majority will have a substantial impact within the next year. And there's a high risk of mortality associated with that within the first year. It's almost 10 to 20%, if my number is not wrong. So you gotta think, wait a minute, this is very serious business here.
Yeah, we're talking about life and death, and people, we just haven't been discussing it in lifestyle medicine. I just feel like we talk so much about heart disease and diabetes and hypertension, which are all very important. But there's also this kind of big gorilla in the room, an elephant in the room, that we're just kind of looking over and going, oh, okay.
Well, I mean, and like you said, I think it's even in the typical medicine, it hasn't raised sufficient attention. And again, I don't want to say, is there an equity in sex here? Because it touched women much more than men. And however, when men are touched, usually then they have a fracture, it seems that it's even worse. So it's important. Yeah, like you said at the beginning, plant-based is just starting. People are just starting to, sometimes when I walk around, they see my shirt. Oh, I just started on please. So I never heard anything like that 10 years ago. People would think I'm crazy to wear a shirt like this. So it's actually, the message is out there. Do they make the relation with the impact that this could be helping women and quote unquote osteoporosis? I don't think so. But we could.
Yeah,
we could
absolutely. Yeah, as I like to tell these amazing doctors that I work with, including yourself, is just how awful that, or not awful, how wonderful, awful, my goodness. I was thinking how wonderful or awesome it is to work with a group of people with a national presence, now that we can work with these patients and really hone in and say, lifestyle medicine works on a national level, and we can prove it. We can actually see the difference, because we are seeing patients from Alaska to Florida to New York to Vermont down to the Southwest California. So,
and I'm hoping internationally for me.
Yes,
Give me some people from France, Quebec.
Yes, we
we
have had patients request Spanish speaking. So I certainly think, guys, that's a perfect segue into discussing your states and your language capabilities. Please share with us the states that you're in and French, obviously, but tell us more.
Well, I'm in Vermont now. So I have license in Vermont, Michigan, Florida, and New York. And obviously international. So at some point, hopefully, it's the message. Once you have somebody from, let's say, Quebec, or France that know what we're doing, that eventually somebody talk to somebody, and this is the best. This word of mouth will make a difference. We're early. When you think the American college kind of start 10 years ago, you were bold sufficiently to think about starting a telehealth clinic prior to the COVID. And now you have 7 of us that are working together.
8 of us, 9, nine now. We'll have 10 by the end of the year, which will probably be where we hold for a bit. But I think I had seen this work really well for a couple of years doing lifestyle medicine on a different platform. And Anthony just kept insisting. I'm like, all right.
He was good.
He had a vision. Yeah.
Yes.
And
and I'm glad to be part of, even if I'm kind of on the other side of my career a little bit, and I do a lot of coaching with physicians. And I would have been sad not having the chance to have this relation with patient and trying to help them in something that I enjoyed. So transmitting this message, I wanted to keep it. So having the chance to work with all of you, it's fun. It's fun to listen to all the other physicians, younger, family practice. It's different than, I'm not used to have all these others. So it's fun.
Yeah. Well, as I enter into my 50s too, I'm thinking, well, how long do I want to be working on this, the patient side, but I want to build the business. So it's an interesting transition as you come in, I think, out of your 40s, and then you kind of enter this middle phase, 50s, maybe towards 60s. It's just a different thought process that starts occurring in your mind that I hadn't been really thinking about, but it definitely hits for sure. So
Yeah, it's all good. It's amazing and it's bubbling. There's people around that are very much interested, that are a little bit away. They will get it. They will get it progressively. And this practice of lifestyle and helping people to change the way they are feeling better, this is gonna be in the forefront of our future. So I think that you're doing excellent.
No, thank you. And I can't wait for everyone to, really start booking up and getting you guys some amazing patients. We've already seen thousands. It's just, and I know what's coming around the corner because there's some big stuff planned for us. I'm really excited. But folks, if you really, really, really want to see the amazing Dr. Elisabeth Fontaine, please check out, it's plantbasedtelehealth.com. You go to meet the docs, or you can scroll down and you'll see her name and go ahead and book. And we're super excited. If you're in the state of Vermont, Michigan, New York, or Florida, or internationally, or if you're close to those states, you can actually go. If you're actually, let's say you live in Pennsylvania, but you're close to New York or New Jersey, you can really step into New York state lines, and at the time of the appointment, actually see any physician that's licensed in that state at the time of the appointment. That's how the laws are working right now anyway. But yes, it's very exciting. And, Dr. Fontaine, do you have any maybe final thoughts or words or suggestions you'd like to share with the audience?
I think we should ask the audience something that you and I had been discussing, doing like a little inside survey. What would be the reaction of your patient, maybe more female, if we were to do a group visit regarding menopause, to have the chance to discuss menopause with, let's say, me as a physician, and see the plant-based, what would be the interest, and maybe they can write it down into your comment and tell us, yeah, I would be in. That would be interesting for us. It's some sort of an inside survey.
Yeah, no, I think absolutely. So if you guys have any interest in group visits regarding women's health, menopause, osteoporosis, things such as those, please, send it. You can either send it to info@pb, like plant-based telehealth.com. You can put it in the comments. I'm obviously observing these on YouTube and Instagram, and Facebook. So wherever you want to put those comments or send them our way, it'd be nice to have that feedback. I certainly know my patients have voiced that they would be interested in that more than a few. And so I think we're definitely onto something.
Yeah, and share and tell us. And we learn so much from you guys that tell us, you look at what we're talking about, and then you help us out to build the future. So thank you.
Absolutely. Well, thank you, Dr. Fontaine, for your time and expertise. And we can't wait to move forward and see where the future takes us with plant-based telehealth.
That's amazing. And thank you. Thank you for having me. And thank you for everybody for listening and giving us input.
Awesome.
Thanks for watching, and I hope you enjoyed that video. Before you go though, please hit the subscribe button and the alert button so you will be notified whenever we upload any new videos. On Monday, we upload the Healthy Human Revolution podcast. Now, if you'd rather listen to the podcast, you can find it on all the major platforms such as iTunes, Google Play, SoundCloud, and even Spotify. Now, if you're looking for more resources on how to start a plant-based diet, sustain a plant-based diet, exercise, recipes, anything regarding wellness, we've got you covered. Check out healthyhumanrevolution.com. And again, thanks for watching.